Hello everyone. Today I'm going to discuss about examination of reflexes. Myself, I'm Ravi Kumar Katta. I'm a senior lecturer and a head of the department. So in this topic, I'm going to discuss about what is reflex, what is the purpose of reflex, and superficial reflex, and what are the deep reflexes, what are the pathological reflexes, and grading, and as well as what are the abnormalities of the reflexes. So before going to start, so just I want to explain about what is reflex. Reflex is nothing but is the involuntary response to the stimulus. Involuntary response. You no need to put any effort to give the response. So that is called as the reflex. Reflex means, for example, simple example is if anybody give any stimulus. For example, if anybody try to poke your eyes, you are going to close your eyes. So that is your response. That is not voluntary, involuntary. Or for example, if anybody pinch yours on your skin, so automatically you take away your hand. So if you pinch here, it's painful, you are going to take away. So this is the involuntary reaction. So that is called as the stimulus. So that is called as the reflex. So it depends on the integrity of the reflex arc, which consists of receptor, afferent nerve, center, and efferent nerve and effector organ. So when you are going to get the response, so if anybody having neurological deficit, so they may lose these reflexes. If you want to get the reflex, so it should be there all the components. All the components means, for example, if you see here, so these reflex arc components are the five components are there. So here five components are the major components are especially this receptor. One receptor should be here, and also afferent nerve and efferent nerve and effector organ. So that means if, for example, if anybody stimulating here, if you touch here, so you are if you anybody pinch here means how you are going to feel the pinch sensations. Here skin has the so here receptor means receive the sensation. So the receptors are there. So these receptor cells are receives the pain signals from here to it takes to the spinal cord. So how this sensation is carried to the spinal cord? Through the efferent nerve. Afferent nerve means which nerve fibers carries the sensation to the spinal cord. So these nerves are called afferent nerves. And from the center, it's going to the spinal cord. From the spinal cord, it's going to the brain. So it's going to the brain. For example, if you see here, if anybody pinch here, if anybody like a pinch or if anybody step on the, if they press any sharp object, so the impulses are going to from here, so the superficial to the from here it's going to the spinal cord. So through the which how it's going through the afferent nerve, that is the sensory nerve. So until after reaching to the this center means the spinal cord and also brain. From here, this spinal cord will give the response to the motor nerve. So it's going to give the response to the motor nerve. So automatically, if after piercing any sharp object, you're going to do the elbow flexion. So that means your muscle, your biceps will going to get the contraction. So that is called as the motor response. So if you want to get the stimulus, all should be intact. Sensory nerve receptor should be intact, and also sensory nerve should be intact. Center spinal cord also should be intact. Motor nerve also should be intact. Then we will get the afferent organ. Efferent organ means the target, which one is going to get the contract. So it gives the signals to the biceps. Biceps will give the contractions. Then it will give the elbow movement. So all the components should be there in the result in the reflex. If anything missing, if anybody having this nerve damage, so how the signals are going to pass to the center? It won't pass the signals, so they may chance to get the loss of reflexes. So that is the physiological mechanism of the reflex. So these reflexes are either monosynaptic or is a polysynaptic. Actually, what is monosynaptic and what is polysynaptic? So if you see this image, you can clearly understand. Just now I explained about the reflex pathway, also called as reflex arc. So here, so what happened? If you see the monosynaptic reflex means here the receptors, for example, if you tap over the patellar tendon, so the reflex, the response, what the response is going to transmit through the afferent neuron, that is the sensory neuron. So it's going to the center to the spinal cord. So spinal cord will give the response through the motor nerve. So it is going to reach to the muscle. So the muscle will give the response. What response is going to give? The quadriceps muscle action is extension of the leg. So if we give the tap over the patellar tendon, the response is going to the spinal cord. The spinal cord will give the response. That response is extension of the leg. So if you tap over the tendon, the response will come to like a extension of the leg. Is because of the contraction of the quadriceps. Here there is no interneuron. There is no communication between the sensory neuron to the motor neuron. So only single direction. So single nerve. So one single nerve means sensory nerve and motor nerve is going to be involved. So this reflex is called monosynaptic reflex. So coming to the polysynaptic reflex means same, the response will be the same, is going to be, for example, if the response, if you give the stimulus in the periphery, from the periphery, it's going to the center through the sensory nerve. So between the sensory nerve and motor nerve, one more neuron is there, the interconnection that is called as interneuron. So is going to give the response, the communication between the sensory neuron and motor neuron. So this responds through the interneuron. So this is the polysynaptic. So this type of reflexes are called polysynaptic reflex. You understand? This is the monosynaptic reflex and also polysynaptic reflex. So just now we discuss about the what is reflex arc. The five components of the reflex arc is called as the reflex. So here we have to discuss about the slightly about the physiology of the reflex. So nerve impulse follows the route through the nervous system called as the nerve pathway. So whatever we give the stimulus here, so if anybody step on the any sharp object, so automatically the signals are going to pass to the spinal cord. So that pathway, how the impulses are passing from the periphery to the center through the sensory neuron. From the center, how the response comes to the effector organ is the muscle. So that pathway, everything is called as nerve pathway. Some of the simplest nerve pathways consist of only two neurons that communicate across the single synapse. Only two neurons are involved, that is the motor neuron and also sensory neuron. So it just now we discussed, so that if you only two neurons are involved, so that is called as monosynaptic neuron. If it is three neurons are involved, more than two, sensory neuron and interneuron as well as the motor neuron. If it is reached to the effector organ through these three neurons is called as polysynaptic neuron. So reflexes are rapid, involuntary response to stimuli which occurs over the simple nerve pathway called as reflex arc. So whatever the pathway, how the impulse is transmitting to the center, from the center how it's the response coming. So this pathway, everything is called as reflex arc. Involuntary reflexes are very fast, traveling in milliseconds. So very fast. If anybody pinch here, so automatically within the fraction of seconds, so within the milliseconds, the impulses are transmitting to the your spinal cord, and also you are going to get the response within the milliseconds. So if you, for example, you are okay listening your music with the close your eyes. If anybody pierce your skin or pinch your skin, so within the fraction of seconds you are going to wake up and you are going to alert. So that is your response. So these responses are going to be lost in case of if anybody having missing in the reflex component, either afferent or motor or any center. If anybody having damage, so they may lose the stimulus and they may lose the response. The fastest impulse can reach 320 miles per hour. So 300 miles are going to be is passing within the 1 hour. So just now we discuss all the components are. First one is we have to give the stimulus. The stimulus is transferred to the center through the afferent neuron. Afferent means the sensory. From the center is going to comes to the effector organ to the efferent. Efferent means the motor nerve. So this everything is called as the reflex arc. So what are the types of the reflexes? So types of the reflexes are two types of reflexes. So monosynaptic reflexes and polysynaptic reflexes. Monosynaptic reflexes are nothing but is a deep reflexes. Monosynaptic reflexes are also called as deep reflexes. Polysynaptic reflexes are also called as superficial reflexes. So what are the superficial reflexes? What are the deep reflexes? We are going to discuss clearly here. So here, if you see the monosynaptic reflex, just now we discussed only one pathway. One pathway means only two neurons are going to be involved. One is the motor neuron and another is the sensory neurons. So, and also in a polysynaptic, sensory neuron also going to be involved and motor neuron. In between the sensory and motor, the connection is there. That neuron is called as is a interneuron. So more than two neurons are going to be involved in the response to the stimulus. So that is called as the polysynaptic. So what are the deep reflexes? So the knee jerk, ankle jerk, and also biceps, triceps, supinator jerk. Superficial reflexes are abdominal reflexes, plantar reflex, conjunctival reflex, corneal reflex, pupillary reflex, celiospinal reflex. How these reflexes we are going to get, so we are going to discuss one by one. So before going to explain these things, actually what is the purpose of the this reflex examination? Why we have to do the reflex examinations? So whether the reflex is present or absent, where the reflex is absent or present, we have to confirm it. Why we have to confirm it? If present, whether the normal are showing the signs of the influences from the higher center are defective. So why we have to know this one? So we have to understand about the centers are functioning or not properly. Is they either brain or spinal cord or motor nerve or sensory nerve is working or not? How we are going to identify? This is the special examination to identify the function of the nervous system as well as muscular system. If any damage in the muscular system and central nervous system, so may chance to get the loss of all these function, all the reflexes. So that's the reason we have to check this reflex examination. If it is absent, whether the arc is breached on the motor or sensory side. So that means where exactly having the problem is because of the motor nerve problem or either sensory nerve problem or any center problem. Whether the any abnormalities are unilateral or bilateral affecting all the reflexes or whether defined level can be is detected in the nervous system at which the abnormalities first appear, because reflex level may be helpful as the sensory level. So that means if we examine clearly, we can clearly identify is there any problem in the sensory part or either motor or is there in the center. So our baby system problem. So where exactly having the problem, so we can easily diagnose. So if diagnosis is clear, so the doctors and also healthcare professionals are going to give the clear treatment. That means a specific target oriented training or treatment. So that is the main purpose of the examinations. If you are not diagnosing properly, if you are wrong diagnosis, so it may won't give properly the treatment plan to the patient, so they may won't get the benefit and also it won't go with the improvements in the patients. So just now we discussed what are the superficial reflexes. So superficial reflexes also divided into the two variations. Again, this one is the cranial reflexes and also spinal reflexes. So what are the cranial reflexes? What are the spinal reflexes? So cranial reflexes, the response coming from the cranium, that means the brain. So it going for the stimulus, the response coming from the brain. And also spinal means it coming from the spinal cord. So here, if you see the cranial reflex and superficial spinal reflexes, we are going to discuss one by one here. So if you see here, we can see that so many different type of reflexes are here. So this one is going to be the corneal reflex, conjunctival reflex, nasal reflex, pharyngeal reflex, uvular reflex. So these are all reflexes are going to be the cranial reflex. So that means especially from the cranial nerves. The response, if the nerves are functioning properly, then only we can get the response. If any defects in these cranial reflexes, it indicates the cranial nerve involvement. That means the improper working of the cranial nerves and also brain structures. So first one is the corneal reflex. In the corneal reflex, how to give the stimulus? So if you want to get the response, you have to give the stimulus. So where to give the stimulus? So that means, so take some small cotton swab. So in the cotton swab, so same like here, the cotton swab, slightly we have to bring it to the edge of the cornea. So the person is going to get the, because of the stimulus, this piece of the cotton, because of we are giving the stimulus with a piece of cotton, so the person is going to respond, so he's going to get the blinking of the eyes. So that is the normal response. If the person is unable to blink the eyes, so it indicates they're having the problem in the fifth cranial nerve. So that means is the trigeminal cranial nerve. So this mainly is going to be the, here, response stimulus is the, which one is the stimulus? Irritation of the cornea with the cotton swab. What is the response? The response will be the blinking of the eyes, the closure of the eyelids. So where the response, how the efferent neuron is going on. So here is the efferent neuron will be the fifth cranial nerve. So that means this trigeminal nerve is carries the stimulus. What stimulus? Irritation of the eye. So this response is going to the center. So if the response going to the center, what is the center? Pons. So that means the is the midbrain. Midbrain in the brain. Pons is the major structure. So what is the response, and also how we are getting the response? The response we are getting through the seventh cranial nerve. Seventh cranial nerve is the facial nerve. So facial nerve supplies to the eyelids. So because of the response, you are going to get the blinking. So this is the normal response. Normal response means, so when we are going to see this abnormal, so if anybody unable to blink the eyes, if you give the stimulus, if no blinking, you always like you're looking like a in the bulging of the eyeballs. So no response. So in those conditions, so it indicates is either maybe defect in the fifth cranial nerve, or maybe defect in the pons midbrain, or maybe defect in the fifth, seventh cranial nerve. So like that, we have to analyze properly, so we can give the clear information about the this stimulus, and also that means we can understand where exactly they're having the problem. And also next one is the conjunctival reflex. Conjunctival reflex means, so we have to give the irritation to the conjunctiva. So conjunctiva, we have to give the irritation, so they are going to get the blinking of the eyes. So they are also going to the same through the same like is the corneal reflex. So if you give the stimulus, the irritation to the conjunctiva, conjunctiva means this one. So they are going to get, if you give the conjunctival irritations, they are going to reach the, again they are going to get the blinking. So this is also another type of stimulation and also another reflex. The third one is going to be the nasal reflex, also called as sneezing reflex. So and also irritation of the nasal mucous membrane. So they are going to get the sneezing. So if you give any stimulus, put the cotton inside the is the nose. If you stimulate and also if you give the irritation to the nasal mucosa, so immediately they are going to get the sneezing. So they are going to sneezing. So it indicates, so the, so that means the normal reflex, the cranial reflexes are working. That means afferent neuron is the fifth cranial nerve, trigeminal nerve, and also it's going to the nucleus of the fifth cranial nerve. So that is in the pons. And also here the response coming through the 10th cranial nerve and also upper cervical nerve. 10th cervical nerve is the vagus nerve, and also upper cervical nerve is the, so these nerves are going to be give the response to the, so nose is automatically they are going to get the sneezing. So these are the some nasal reflex. Coming to the another reflex is pharyngeal reflex. Pharyngeal reflex means irritation of the pharyngeal mucosal membrane. So how we are going to give the irritations? So they are going to get the retching or gagging. So they are going to get the mouth opening of the mouth. So if we give any irritation to the pharynx, so like that, if you give the irritation here, is opening the mouth. So this also, this stimulus is going to the center through the ninth cranial nerve, glossopharyngeal nerve. So and also it reach to the center, that is the cranial nerve. So that they are going to get the response through the 10th cranial nerve through the vagus is going to get the opening of the mouth. So this is the response. Another reflex is uvular reflex. Uvular reflex means irritation of the uvula. Uvula means you can, if you open the mouth, the inside the small tongue in the above the soft palate. So if you stimulus, if you give the irritation, if you poke the uvula, so automatically the uvula going to raise the uvula, so it going smooth upwards. So this is called is the normal response. So when this, so this is also going through the ninth cranial now, that is glossopharyngeal now, and also the response going to the center through the vagus now. The vagus now will give the response, that is the elevation or upwards movement of the uvula. So these are the cranial superficial reflexes. So when these reflexes are going to lose, so if anybody having any damage of the brain, any in case of head injury or in case of any cranial nerve injuries, especially fifth cranial nerve, and is the fifth cranial nerve is the trigeminal nerve, 10th cranial nerve is the vagus nerve, and also spinal accessory nerve, and also glossopharyngeal nerve. If anybody having damage of any injury or any tumors around this cranial nerves, so may chance to get the loss of these reflexes. So and also they may give the abnormality is they either hyper or hypo reflexes. Hyper means it give the stimulus is response will be more, or the hyporeflexia means the response will be less. So that is the about the superficial reflexes. So just now we discussed how to do the corneal reflexes. So that means we have to ask them the patient sit comfortably, and also ask them to look at one center point. The gaze should be stabilized. So in the edge, we have to bring the cotton swab. So ask them to, okay, if they look at the straight and if you irritate the cornea, they are going to get the blink movement. So that is the normal response. So if they are not getting the response, so it may be the pathological. So we have to find out where exactly they're having the problem. And also while checking the corneal reflex, we have to check the both sides. Any reflex also, we have to check the is it normal or abnormal. We have to compare the other side also. So if you do the right side, then have to the left side. So sometimes it may give the right side response, but sometimes may won't give the left side. So then we can understand which side the fibers are is intact, is working properly. So then we can easily understand. Is it clear? Hopefully you understand clearly, because I'm going very slowly for your understanding purpose. I'm going to step by step. Hmm? Okay. So next one is, so just now we done the corneal reflex, conjunctival reflex. We have to irritate the conjunctiva. Just now we discussed. So this also trigeminal now, and also is going to give the blinking facial now. So we have to do for the both sides, right side as well as left side. We have to continue these things, and also next one is the pupillary reflex. So this pupillary reflex is mediated by the third cranial nerve. So third cranial nerve is the oculomotor nerve. So first one is the olfactory nerve, second is the optic nerve, third one is the oculomotor nerve. Oculomotor nerve is mainly supplies to the eye muscles, eyeball muscles. So here we have to check the pupillary response. So light reflex directly and indirect, and also accommodation reflex. So here we have to check the light reflex. Light reflex is the direct one. So how to check this direct one? Make the subject sit comfortably. Ask the subject to fix the gaze in the distant object. So we have to fix the one object. Ask them to look at the straight. So ask them to concentrate on any particular object. Since the bright light into the one eye with a torch, so ask them to bring the one torch to the one eye. So the response, you observe the immediate constriction of the pupil on the same side. So the pupil is going to be constricted, is going to be closed. So dilation means it's going to be the opening clearly. So if you put the torch to the right side of the cornea is going to be string, is going to be constricted, is a pull inside. So that is the response. So elicit the light reflex on the other side and compare. So we have to do the right side as well as the left side. So next one is this also is the third cranial nerve is going to be accommodation reflex. So accommodation reflex, how to check the accommodation reflex, and also is we have to do the make the subject sit comfortably, ask the patient to fix the gauge and distance object, bring your finger midway between the near the eyes. So ask the subject to look at the tip of the index finger. So observe the constriction of the pupil and convergence of the eyes. So here, if you bring the finger into the center of the eyes, so ask them to look at here. So what will the response? The response will be the constriction of the pupil is going to be constriction, and also eyes will be convergence. So it's going to give the direction. So if you see here, convergence is going to happen. So this is the normal response. Who, if anybody having any third nerve cranial nerve injury or damage of the oculomotor nerve, so if you bring here, they are unable to look at the index finger, and also they won't get the pupil constriction. So it indicates the abnormality in the cranial nerve. So with these special reflexes, we can easily identify the where exactly having the nerve damage. Is it either cranial nerve or it may be the spinal nerve? So we can easily understand, or maybe localize any damage in the eyes. So we can easily understand. So that's the reasons we have to check the all the reflexes through the reflex examination. Next one is the celiospinal reflex. Celiospinal reflex means this is also pupillary skin reflex. It consists of dilatation of the ipsilateral pupil in response to pain applied in the neck and face and also upper trunk. So here is going to be, for example, if you give any pain stimulus, if you give any pinch in the neck region or in the face region or maybe upper trunk, so is going to give the dilatation of the ipsilateral pupil. So if you give stimulus, so it's going to give, because of this response is going to the pupil is becomes the dilation. So that is the normal response. So we already discussed. So this one is like a polysynaptic. The superficial reflexes of the polysynaptic. Stimulus in the neck or face or maybe upper trunk also. The stimulus is going to the center, and in between center it's going to be connected with the interneuron. So it gives the response like a is going to dilation of the pupil. If the right side neck is subject to painful stimulus, the right pupil is going to be dilated. So if we give the right side pupil is going to be dilated. If the left side pupil is going to be dilated. So that is the normal response. In case of if anybody having damage, so it indicates the pupillary, the skin reflex is going to be absent because of the damage. So other reflexes are, so we can see the scapular reflex, upper abdominal reflex, lower abdominal reflex, chromatic reflex, gluteal reflex, plantar reflex, and also bulbo cavernous reflex, anal reflex. These reflexes are called as is the spinal reflexes. So superficial reflexes are the cranial reflexes. Until now we finished the cranial reflexes. So here we are discussing about the superficial reflexes of spinal reflex, spinal related reflex. So here the first one is the scapular reflex. Scapular reflex means irritation of the skin at the interscapular regions. So what happened if we scratch in between the scapula, in between the shoulder blades, if we scratch or if we pinch anything, so what will be the response? Contraction of the scapular muscles and drawing of the scapula. So that means they are going to do the scapular. If you stroke anything, they are going to do the contraction. So this is a normal response. So it indicates that it's going to the center, that is, it indicates the C5 to the T1, C5 nerve root, C5, C6, C7, C8, and T1 nerve roots are responsible for the scapular reflex. If scapular reflex is absent, so in this condition, in which conditions, if anybody met with any road traffic accidents, if anybody met having any problem in the cervical region damage, so they won't get any response or maybe delayed response or hypo response. So coming to the upper abdominal reflex. Upper abdominal reflexes, the stroking in the upper abdominal wall below the costal margin. So here, if you see here, okay. So here in the abdominal reflexes, so we have to check the upper abdominal reflexes and lower abdominal reflexes. So if you stroke around the, for example, this is the umbilicus. So with a sharp object, if you stroke here towards the below the costal margins, is if you stroke upwards, and also what happened? This is the stimulus stroking upwards. This is stimulus, and what will be the response? Response will be the contraction of the this umbilicus is going to contract, is going to be pull. You can see easily. So whenever you are doing a practical time, so you have to practice these things. You observe the contraction of the umbilicus. So if you stroke upwards to the right side, so this right side is going to be contract. The umbilicus is going to contract. The left side, the lower abdominals, if you stroke the towards the lower side, the downside, so this side, left side is going to get the contraction. To the right side stroke, if you're going to get the contraction to the right side. So upper abdominals and lower abdominals. So these reflexes are very, very important in case of spinal cord injury patient assessment. So these reflexes are going to be absent in case of spinal shock. Spinal shock means if anybody met with an accident, spinal cord injury, so the person is going to lose all the functions. So unable to respond if you give any stimulus, no response. If you pinch, you won't feel any pain. If you pinch in the lower limb, you won't respond. You won't get any movement. So we have to know how do we get if the patient is in spinal shock or not. If the person still having the loss of the all the reflexes such as the abdominal reflexes, upper abdominal, lower abdominal reflexes. It will, if anybody get the response, contraction of the umbilicus, so the person having the now like a come out from the spinal shock. If it is still loss of the abdominal reflex, it indicates the person with the spinal shock. So that is the one other example for the superficial reflex. Another one is the cremastic reflex. Okay. Next one is a cremastic reflex. Cremastic reflex is nothing but here. This is also one of the superficial reflexes. This reflex also we are going to do in case of spinal shock assessment. So if anybody met with an accident with the spinal cord injury, still if the spinal shock is there or not, we can diagnose with the cremastic reflex. So how to perform the this cremastic reflex? So cremastic reflex, if we stroke inner border of the thigh, so near to the our genital area, the male genital area. So if we stroke in the with a sharp object near to the inner part of the thigh, so what will be the response? This is the stimulus. The response will be the testicles in the males. The testicle is going to be it moves upwards. So the contraction of the cremaster muscle, so it means this moves to the upwards. So this is the normal response. If no response, if the cremastic muscle reflex is absent, it indicates the still the person having the spinal shock. So this is in the male persons. And also how the response will be in the female person. So that means if we stroke in the inner border of the thigh, so the response will be the contraction of the vaginal muscles. The vaginal muscles are going to show the response is going to get the contraction. So this is called as the chemastic reflex. We can easily do this reflexes in assessing the spinal cord injury patients. So coming to the another one is the gluteal reflex. The gluteal reflex is stroking the skin over the gluteus. Gluteum is the buttock muscles, your butt muscles. So if you stroke up the butt muscles, so it's going to give the contraction of the gluteal muscle. The muscles are going to get the contraction. So here, so the response coming from the L4, not lumbar 4 and lumbar 5, S1 and S2. So if anybody having damage, especially the lumbar nerves injury in case of disc injury or maybe spinal cord injury, so this reflex will be lost. So we can easily understand if the person nerves are intact or not. We can easily understand. So next one is the commonest reflex in the superficial reflex is the plantar reflex. Plantar reflex is nothing but we have to stroke the patient should be relaxed and also either the long sitting position or lying positions. So in these conditions, if we stroke from the lateral border of the foot towards the middle border of the foot. So from here, lateral here, so sole the boot from the lateral side is going to until the medial side until the big toe. So it indicates, so in the normal response, the response will be flexion of the all the toes. So this means flexion of the all the toes. So that is the normal response. So this is the superficial reflex. This also we can check if the person having any upper motor neuron lesion or any brain injury or any spinal cord injury. We can easily identify with this reflexes. That is the Babin. This is the plantar reflex. So in case of if the person having the abnormal response means you can see here the abnormal response is called as Babinski sign. So Babinski sign positive. So that means if we stroke over the lateral border of the sole of the foot to medial border of the sole of the foot from the lateral to medial, so what will be the response? The big toe is going to be the extension position. The other toes are going to be fanning, is going to be opening. If you see here, this is the normal one. Normal one is called is the, so here is going to be the all the flexion, all the toes will be flexion. But in the pathological sign or pathological reflex, that is also called as is a Babinski sign. The big toe will be in the extension position. Other toes are going to be the fanning. So that is the pathological sign of the Babinski sign. So why this they are going to get the extension of the toe and also other fingers, especially if anybody having spinal cord injury, upper motor neuron lesions. Upper motor neuron lesion means in the center or brain. So if anybody damage in the upper motor neurons, so those people will get the this pathological positive sign, that is a Babinski sign positive. But when this sign is going to be the normal, but if you check in the kids before the 3 years, this sign is going to be the positive. Which sign? Babinski sign will be the positive. So if the kids below the 3 years is the Babinski sign is positive, is it the positive or negative sign? Is it the normal or abnormal? In the kids before the 3 years, it will be the normal. Why it will be the normal? In the kids, if you stroke out the lateral border of the foot, again they are going to get the extension of the big toe. Other toes are going to be the fanning, are going to be spread. So that means in the before the 3 years, the myelination process is not completed. So that is the reasons they are going to get the extension of the big toe. So the Babinski sign is going to be positive in the kids. So, but this is the normal. That is not a pathological sign. If it is the more than like a, in the after 3 years or in the adult, if it is the positive, it indicates the upper motor neural lesions. Either may they if they're having the brain injury or either spinal cord injury. So those people may having the hyperreflexia and also they may have the like a fasciculations. They may have the like a hyperreflexia, and also they may chance to get the exaggerated reflex. The reflex are going to be exaggerated. They may chance to get the spasticity means abnormal muscle tone, increased muscle tone because of the upper motor neural lesion. So it indicates the upper motor neural lesion above the L5 segments. So if it is the, that means above the L5 segment, lumbar segment having the damage. So next one is bulbo cavernous reflex. Bulbo cavernous reflex means, so this also the superficial reflex, and also this bulbo cavernous reflex also commonly check in the in case of spinal cord injury, either spinal shock is present or not, we can check it with the bulbo cavernous reflex. So how to do this bulbo cavernous reflex? What is the stimulus here? Stimulus is only thing is this reflexes is the compress the glans penis in the males by applying the pressure on the glans penis. In the females, we have to press the clitoris, the vaginal above the clitoris. If we press on the clitoris, so what happened? The contraction is going to be the anal sphincter. So anal sphincter is going to get the contractions. So anal sphincter is going to contraction. Either is going to the bulbo cavernous muscle, the bulbo cavernous, is going to get the contractions. You can find the contraction in the bulbo cavernous muscle. So that is there in the penis and also bulbo cavernous and also in the towards the uh, anal sphincter. So that means it's going to give the response. Anal sphincter is going to get the contractions. So in the females, we have to give the stimulus over the clitoris. So and also in the male, I have to give the press over the or compression over the glans penis. So it will give the response will be the contraction of the bulbocavernous muscle and contraction of the is anal sphincter. So this is the normal response. So in case of spinal shock, these reflexes are going to be absent. So just now we discussed about the abdominal reflexes, and also these are the upper abdominal reflex and lower abdominal reflexes. So here we are going to what we are going to elicit, what we are going to find. So that means either spinal shock is there or not. Along with we are going to find the segmental innervation is there or not. That is the T7 and T9, and also for the upper abdominals T9 and also T9 to 11 is going for the upper abdominals, and T11 to T12 is going for the lower abdominals. We have to see so how it is responding epigastric level and upper abdominal level, lower abdominals. We are going to find the abnormality. So next about the deep tendon reflexes. So these deep tendon reflexes are very important assessing the tendon, especially related to the muscles. So here it will be the deep tendon reflexes also called as monosynaptic reflexes. This is the biceps reflex, triceps, supinator, knee jerk, and ankle jerk. So these reflexes, while assessing the motor examinations, if any patient come with a motor disability or motor problems, if the person is unable to walk, if the person having the motor weakness, muscle weakness, if the person having any like a stroke patient, so if any patient is conscious or unconscious, so if we do these reflexes, so we are going to find the status of the nervous system. So first one is the biceps reflex. So biceps reflex, the person should be relaxed either sitting position or lying positions. So here the examiners is hold the forearm and also place the finger over the gently over the here. So here the therapist and also doctors has to hold the elbow properly and also should be relaxed over the doctor's elbows and all. So we have to place the thumb over the tendon, biceps tendon. So without placing the thumb, so if you tap with the knee hammer or reflex hammer, it won't get a proper response. So if we place over the tendon, if you tap over the finger, so the stimulus will reach to the from the here. This is the afferent neuron, sensory neuron. It's going to the spinal cord. The spinal cord will give from the motor response. Then it will comes to the contraction of the biceps. The response will be the elbow flexion. So in case of the muscle weakness, in case of, for example, C5, C6 nerve root is weak or damaged or maybe compression in the spinal cord, so the reflex will be very weak or maybe absent. In case of spinal cord injury or in case of only particular the C5, C6 nerve root damage, so may chance to get the weakness of the biceps. Or maybe if it is exaggerated, that means the sharp movement or faster movement, so it will be the upper motor neural lesion. Either is a spinal cord injury or is there maybe is because of the any disc compression, it may use the it may use the hyperreflexia. The response will be faster. So that is the biceps reflex. Supinator reflex. So this supinator reflex, we have to tap over the supinator muscles. So this also mainly we have to check the C5, C6 nerve root. So over the lower end of the radius and also about the 5 centimeters above the wrist. So here we have to tap over the here. So here, if we tap over the supinator jack, if you tap here, so he's going to get the supination. So with a normal response, you stimulate over the lower end of the radius, so 5 centimeters above the wrist joint. So the response will be the supination. So he's going to get the supination movement. Next one is the triceps jerk. So tricep jerks mainly we are going to find the response innervation is the C6, C7. The tricep jerk. So in this examinations, the patient should be in the supine lying position, either prone lying positions. But only thing is we have to bring them into the elbow into flexion position because This triceps action is extension of the elbow. If we give the stimulus to the elbow joint, if we tap over the elbow joint above the triceps tendon, so the response will be the extension of the elbow. The response, if you tap over the tendon here, it automatically is going to the extension positions. So that is the normal response. So if anybody having the hyperreflexia is because of the upper motor neuron lesions, or maybe if the hyporeflexia is maybe because of the lower motor neuron type of lesion. So that is the only particular nerve group is going to be, the nerve segment is going to be involved. In those conditions, the response will be hypo or less. And also coming to the knee jerk, so knee jerk, so and also the patient should be is a high sitting position, or maybe we can the patient in the lying positions. In the lying position also, but the only thing is we have to give the support to the knee joint. Then only we can elicit the tendon tap. We can use the reflex hammer tap over the patellar tendon. So if we tap over the patellar tendon, the reflex will be goes from this receptor is going to the sensory neuron to the spinal cord, that is sensory afferent neuron. From the spinal cord the response comes through the motor neuron, so it reaches the quadriceps. The quadriceps will give the movement, that is the extension of the knee joint. So this extension of the knee joint response, it indicates the, it is the intact of the L2, L3, L4 nerve root. So if any weakness or if any hyporeflexia, it indicates the lower motor neuron type of injury. Or if it is hyperreflexia, is either maybe spinal cord injury or maybe is the stroke patients. They are going to give the hyperreflexia. If you tap here, the force will come very fast. So that is the hyperreflexia. The reflex will be the exaggerated, faster. So we can do in the supine lying position as well as we can do in the still high sitting position on the couch. We can ask them to sit on the high like a couch. So in this position, the patient should be relaxed. Then we have to tap over the patellar. If the patient is excited or anxiety, if the patient is not concentrated, sometimes if the patient is scared to do involve in this examination, so they may won't get the proper responses, they may won't get the proper response to the stimulus. So in those conditions we have to use the another methods, that is another techniques I will explain in the next slides. And also next one is the ankle jerk. So ankle jerk in the patient should be in the supine lying position. So supine lying positions, the hip should be externally rotated. So here we can make them into the supine lying positions. Hip should be external rotation and slightly bend the knee joint and also bring to the dorsiflexion. So here knee should be the flexion, hip should be in the external rotation, is the foot should be the dorsiflexion. So in these positions, so make the dorsiflexion, tap over the tendo-Achilles. So tendo-Achilles means the tendon of the Achilles. So where exactly the insertion of the gastrocnemius sensualis. This if you tap over the tendon, the response will be the plantar flexion. The response if you tap over the here the tendo-Achilles, the response will be the extension or also the plantar flexion of the ankle. So that is the major response. But here so we can check with the S1 and S2 response intact, nerve should be intact. So if anybody having sciatica or if anybody having any nerve injury, S1, S2 nerve injury, so they may chance to get the less contraction. There is no proper contraction of the like a dorsiflexion as well as there is no contraction of the gastrocnemius and soleus. So normal response, the plantar flexion of the foot and contraction of the gastrocnemius muscle. So this is the normal response. If anybody having the problem with this now, so they won't get the plantar response and also no contraction of the gastrocnemius. Sometimes if the patient is anxious, they won't get much response. And also in case of one more deep tendon reflex is the jaw jerk. So jaw jerk, so this one also we have to do if the patient is comfortable sitting positions. So here we have to place our index finger over the jaw. So then ask them to deep breathe in and also relax posture. Then if you tap over our finger, so what happened? So this going to be the immediately the response is closure of the mouth. So if you tap over the jaw here from here is going to be response, the mouth is going to be closed. So this response is due to contraction of the elevators of the jaw. So because of these things, so this elevator jaw elevators are going to be contract. It helpful to the closing of the mouth. So just now we discussed, right? So if the person having difficulty in getting the response, what response? If, for example, if you are doing the biceps reflex, if you are tapping in the biceps reflex, or maybe triceps, or maybe supinator. So this time, sometimes the person is the normal person, but they won't get any proper response. There is no proper elbow contract, elbow flexion. There is no elbow extension, no supination. This may because of the patient, the person may having the like a anxiety or maybe depression, or maybe the patient is like a scared to participate in the examinations. In those conditions, we won't get much like a responses. In those conditions, we have to use the special maneuver, that is the Jendrowski's maneuvers. So Jendrowski's maneuvers means, so if you are performing any for the upper limbs, the reflexes, so ask them to do the hold the ask them to clench the teeth, and also ask them to hold the squeeze the thighs. For example, if they are doing for the upper limbs, if they concentrate, clench the teeth, and also concentrate thighs. If they try to squeeze the thigh muscles, so these upper part body muscles are going to be relaxed. Then if we tap over the biceps, so it will going to give the more easy response. So this is performed by the asking the subject to make a strong voluntarily. So that means muscular effort using the following methods. While testing the reflex of the lower limb, ask the patient hook the fingers of two hands together to pull them apart. So if for example, if you are checking for the lower limbs, so ask them to hold the hands in the hook-like positions. Ask them to pull. So if they pull, they are going to be voluntarily is activate. That means concentrate on the upper limbs. The lower limbs will be relaxed. So the if you give the stimulus in the if you stimulus over the quadriceps, that is patellar tendon, and also if you give over the ankle jerk, so it will give the response will be more like a prominent. While by testing the reflex of upper limb, ask the person to clench the teeth and make the fist in the hands. So we can ask them to do the clench the fist, clench the teeth. So here ask them to clench the teeth and also make the fist making. So if they do this, reflexes upper limbs, biceps and triceps and supinator, so they are going to get the prominence. So that is the main like a this is the special maneuver. If sometimes while checking the reflexes, you won't get much like a satisfaction of the response, then we can use the this Jendrowski's maneuvers. So these are also just now we discuss all the jerk reflexes. Okay, so how to grade the reflexes? So when we can say is a normal response or is it an abnormal response? So is on after checking the reflexes, so the reflexes are going to be either absent or maybe hyperreflexia or hyperreflexia or brisk or clonus. So what is that? This grading. So grading, if you see the zero means is the absent. If you tap on the biceps, no response, nothing, even no flicker contraction. So that means that is called as that is due to is the lower motor neuron lesions. So that means the single spinal nerve is going to be affected. So that is the absent of the reflexes. That is zero grade. Next one is the grade one. The reflex will be present but depressed. Depressed means the reflex will be the mild hyporeflex. If you tap here, the elbow contraction is only slightly contract, only slightly contract. If you tap here, slight contraction. So it is the normal but may indicate the neuropathy. May neuropathy means is maybe damage of the single nerve spinal or maybe because of the any compression of the nerve because of spinal cervical spondylosis or maybe lumbar spondylosis, any degenerative conditions, or maybe if the nerve having any alcoholism, severe alcoholism. So, and also any lack of vitamin deficiency. So that means vitamin deficiency problem, or maybe other complication, any infection to the nervous system. So it may affect the now the reflexes. They are going to get the response, but very low. And next one is the present or brisk. So that means if you give tap over the tendon, like stimulus over the biceps, is going to the normal response. If you tap here, is going to get the flexion. So that is a normal response. Very brisk or increased. So it may be if you tap over the biceps, is going to be very fast. So that indicates the is maybe the normal, but indicates the upper motor neural lesion. Upper motor neural lesion means is there either damage in the brain or maybe in the spinal cord. So next classification is a grade. Grade 4 is the clonus. Clonus means what is the clonus? Clonus means is the exaggerated movement. Exaggerated movements the movement will be hyper. For example, if the patient is the long sitting position or supine lying positions, if we give the dorsiflexion movement of the ankle, if you dorsiflexion of the ankle, if you stretch and leave it, the ankle will be going to be the tapping, is going to shaking movement. So that is called as the clonus movement. Is purely is upper motor neural lesion. Or for example, in the for the upper limbs, so if we give the contraction from supine in this sitting positions, if we give the dorsiflexion of the, if you give the or extension of the wrist, if you leave it, it's going to get the shivering movement in the wrist. So that is called as the clonus. So this clonus commonly be observed in the upper motor neural lesion, especially in the brain injury. So, what is exaggeration? What is the diminished reflexes? Abnormalities. The reflexes may be exclusively brisk, the movement being sudden, short, and live jerk. So, this type of reflex commonly upper motor lesions, also seen in the any fright, anxiety after violent exercise, but then return to the normal and the rest. So, they may chance to get the abnormal upper motor neural lesion, or maybe in the depression, or and also in the violent exercise, but if they take the rest, it will come normal. But in case of brain injury, it won't come normal. So if the brain problem subside, so that the reflex is going to be normal. The reflex may be clonic. Just now we discussed the clonus, right? The muscles has been stretched, goes into the clonic contraction, is a involuntary contraction until stretch is relieved. It is seen in the pyramidal disease and also tension individuals. Pyramidal disease means the pyramidal tracts, the spinal cord tracts, even in the which is mainly is responsible for the movement. So if anybody having the damage in the pyramidal tracts, so may chance to get the clonus. So reduction are absent. So these reductions are going to be absent in case of any nerve injury or neuropathy or any peripheral nerve injury, any myopathy diseases, or in the during the cerebral spinal shock. In case of shocks and also the neurological disorders, so these reflexes are going to be absent or maybe is the hypoactive. So that's all about the today's topic. That is about the spinal and also what are the reflexes. So just until now, we discuss about the what is reflex. So what is the reflex arc we discuss, and also what is the purpose of the reflex we have already discussed, and also what are the types of the reflexes, superficial reflexes and deep reflexes. What is monosynaptic reflex? What is polysynaptic reflexes? So what is the difference between the superficial reflexes? What is the difference between the deep reflexes? Why we are going to do the find the superficial reflexes in the spinal cord injury, and also how we are going to perform the deep reflexes. So what is the indication, what is that means what is the means of the deep reflexes, if it is exaggerated, if it is diminished. So these are all reflexes we are going to do this for the purpose of the identifying any problem in our brain or spinal cord or in our musculoskeletal system and neurological system, and these things are helpful to identify the health status of the patients, and also we can easily identify the any neurological any pathological conditions in the patient. So we can do very easily if you practice, so how to perform the exercise, how to perform the reflexes. So if you are find any abnormality in the reflexes, try with the special maneuver. So that special maneuvers for the upper limbs and also lower limbs, so we can get the best results. If you're not finding the best responses from the patients. Okay, that's all about today's topic. So hope you understand clearly. If you have any doubts, you can send me a message. I can explain, I can clarify your doubts. Thank you very much. See you in the next class.